Hello, everybody. Thank you for listening to the Healthy Project podcast. I'm your host, Corey Dion Lewis. I have an exciting guest on today. We have Dr. Bayo Curry-Winchell. Super excited to get into this conversation. And I was just telling her a little bit about how I stumbled upon her TEDx, which really spoke to me because of what I do. So, Dr. Curry Winchell, thank you so much for being on the podcast with me today. I really appreciate it.
Thank you for having me. I am excited to talk about this important topic and just share information. I'm just excited to discuss and let's amplify this message.
Absolutely, absolutely. So, before we get into the real conversation, how about you tell the people that are listening a little bit about yourself and what gets you up in the morning?
I would say, there's so many different pieces when I think of Dr. Bayo Curry-Winchell. Important pieces, I go by Dr. BCW, which also stands for Beyond Clinical Walls. And when you mention Corey, what gets me up in the morning? It's really delivering healthcare in a non-traditional way. I love providing the pieces of healthcare in new and innovative ways and finding ways to highlight marginalized communities and people of color and sharing the information that I've been privileged to get to know and put it forward. And so my journey has been so just really dynamic. So I am a mom. I like to talk about that for of two little girls and a wife and a practicing physician, as well as a medical director for several hospital systems. And so through that work, I've been able to highlight health inequities and disparities because my passion truly is that. And so when I think about how I was taught, of course, within healthcare to do no harm, this is my way of giving back in any way that I can. And another piece that I think is important when you think about what drives Dr. BCW, another component I always have to talk about is my dad. He just recently passed away, but was a force to be reckoned with. A 99-year-old African American man who was a World War II, Korean, and Vietnam War veteran, a man that really implemented and showcase what it was to give back in any way that you can. And that's how I grew up and that's how I live my life. So that's a little bit about my my journey, and it truly is a part of what I do every single day.
Yes, and you spoke about your father in the TEDx speech, and I'll make sure I have that linked in the description of this episode. And it leads to my first initial question that I have for you is that mistrust in healthcare. And so, what I'm asking is, is healthcare mistrust? Should we be looking at this as a health disparity or a public health concern?
We should, because it is a piece, it's a core of why there is this disproportionately higher rate of disease, of preventable diseases, of health outcomes. It's a part of it, and it should be at the same level of any sort of public policy because it's instrumental to healthcare. And when we look at the historical mistrust and the ongoing mistrust, that is the way we are going to be able to make progress. We have to acknowledge first in order to make steps moving forward.
Yeah, and I feel like that's the piece that I feel like's missing is the acknowledging that there is that mistrust, right? We all know we know the history of how people of color are treated in healthcare. It's there. You can't deny it. But there's almost this feeling of in a way like hey, that was the past. This is not how it is now, but there's research to show that it is still kind of it is still there.
That is correct. When you look at how certain diseases tend to be penned or labeled as a specific color of diseases, such as, oh, diabetes, often labeled as a problem of Black people, and that is such um, an important example of how we are labeling race and associating it with diseases. And so it was really important to me to kind of take it from the like anatomical level that our organs are the same. So why are we practicing medicine in a way that looks at the color of our skin? And we know race is a social construct. It has nothing to do with how your organs work, how you process actual medications and so forth. And so when we look at that, we define ethnicity versus genetics versus race. And so when you look at that, that is how you really start to build trust, because once you can inform yourself and know the differences, then you're able to take a step back and look at not only historical mistrust, but what we are doing now still, and that continues to play in every element of healthcare.
Yeah, and I feel like that mistrust is passed down. Because I can say that I don't feel like I've ever been mistreated within the healthcare system, but I will tell you, when the pandemic happened and healthcare providers and professionals were getting the vaccine and it was offered to me, I immediately had this fear. Even knowing the research and having a trust in that, there was this part of me that was like, I don't know.
Like, I'm not getting that. And that's so important, and that's why in my TED Talk, I talk about how my dad, really was like, and those were his words. He was like, I'm not getting that. And that
Yeah.
kind of message that we all hear through our grandparents, our parents, sharing the mistrust that they have. And so it's multifaceted. There's so many different areas to it. Number one, of course, we talk about acknowledging it. Number two, asking why there's mistrust. Because when you have this kind of historical mistrust that's happening, until you ask people, why is it that you are concerned about this? Versus talking at them saying, you need to get this, you should have that. When you ask the why, that is a gift of
Mhm.
understanding, acknowledgement, and movement forward. And to your point, so many of my patients were like, I'm not going to get that. Why should I? And the way the message was put forward, it wasn't in a way where I'd like to ask questions about it. It was, no, you need to get this. And that message has to change in all areas, whether it's COVID, any disease process, we
Mhm.
have to do better.
No, absolutely. What I liked about your talk, you said, when your solution or one of your solutions for mistrust was representation, which I totally understand and I agree. And but for someone like myself, I live in the Midwest. We're not in Iowa. I'm not seeing a lot of Doctor Curry Winchells around that I can just go and get my service, and be my primary care provider. But we do have providers that are white, that want to be allies, that want to know more and do better. So how can those providers who do want to support people of color, what are the things that they can do to be better at supporting?
I think there's so many different things, but a couple of really important parts are number one, educating and informing yourself about the mistrust. Because once you do that, you've got that blueprint of understanding. And then listening. And I had shared earlier, asking why your patient has mistrust. That is so important. Instead of assumptions or feeling like this person doesn't want to be compliant, which is a word that we often use,
Mm-hmm.
ask why, because that is a way to kind of have a baseline, a threshold of building trust, because now you have taken the time to get to know your patient in a way that they feel like you actually care about them. And so if you are, a provider that's not of color, starting there is so important. And also thinking about those unconscious and implicit biases that you may have. And that starts from just, everyone has them, but also thinking about some of the information you have learned throughout your journey in healthcare. And so we are taught that race-based medicine in certain elements like hypertension is okay. And there have been so many studies that show it's not, it's actually harmful. So I would say, those physicians of that aren't of color, think about what you're doing right now and look and see if it's evidence-based. And even if you see some sources that seem like it, taking a look back and saying, anatomically, kidneys are the same. Race is a social construct. Why am I giving a medication for Black patients only? Why is it that we say hypertension and diabetes are at a higher risk for Black patients versus looking at ethnicity or culture or social determinants of health? And so all of those things are really wrapped into a package of education and informing yourself, and also going against the grain and thinking about, am I doing the right thing right now? And I think that is a huge way that you can really deliver healthcare in the way that it should be delivered.
No, that's a great response, and I feel like right now as healthcare is healthcare is constantly evolving, right? Like it's always going forward. Uh, what I feel like gets people stuck is what you kind of spoke about is that cultural competence and awareness. And when you're in it and people are not, well, first of all, let me ask this question to you because I'm really curious. Going through, your training, was cultural competence and awareness, was that a part of that? Like, or was it just not something that was thought of
I would
until
say
now?
I would say it was pretty superficial. It was not delved into as deep as it needed to be. It was
Mhm.
sometimes sprinkled in certain things, but it wasn't given the um the level that it should be. Like when we talk about public policy and race and different types of things that are impacting healthcare, and finding why we are moving forward in the way we are, it's because we're not amplifying it to the level that it should be. That curriculum of cultural diversity and really understanding people's background needs to be just as important as biochemistry, pathology, because
Right.
all of those things are together. And so it wasn't. And some institutions have really increased their curriculum in it, but more needs to be done. And it's not just, oh, we're going to give you a semester of it. It needs to be it needs to be blended in throughout your entire curriculum. And then also this part, because as providers we have to do continuing medical education credits, so that should be a requirement. I have to take, I think it's ethics and other classes, but let's do cultural and
Yeah,
linguistic competency as part of a requirement to remain board certified. I think those things are solutions or ways to kind of continue to inform the importance of this topic.
absolutely. 'Cause I feel like cultural competence and trust, they go hand in hand. Like if you don't
Yes.
understand your patients, they can't trust you or they're not going to, so building that trust is a part of all of it. No, that's great. So, like I said before, I don't know many black providers, and when I do, I get so excited. I have a friend of mine that's his first year, and I'm so super excited for him. So when I see, honestly, when I see or I speak with black providers, I just look at you guys as superheroes. I mean, I really do, because, but so, can you tell me a little bit about your experience, not only being a black provider, but a black female provider, which is a whole different challenge, right? Like that's a
Right.
whole different level of challenge. Can you tell me about that? Were there insecurities? What were some of your proudest moments? What got you to where you started to where you're at now?
So, this journey has been amazing with lots of bumps and in the road, but I can tell you I love what I get to do. I love being a physician. It brings me so much joy to see patients and just try to help them, especially during their most, vulnerable times. And my journey really involved people helping me. And I think that's something that we have to think about when we talk about representation and how often people of color do not have that network system to be able to kind of help them through. And I had to go out and find it, because it's hard. How do you take the MCATs, which is that preliminary test to even get into medical school? How do you apply for student loans? How do you find people to shadow because you need clinical hours to be able to put that on your application?
Mm,
And so
mhm,
these are things that we need to invest in for Black and Brown students so they can get there because that network or that umbrella isn't always there for us. And so I think that's an important piece that we have to look at. And so I'm grateful, with that drive and persistence of finding different people, asking for help, and then getting that help, which is also another, piece that I'm so lucky that I had people help navigate. And so, being a Black medical student just in general, that was very interesting, especially when you looked around and nobody else looked like you and no one had the same experiences or the challenges that you had faced. And then for me personally, I can say, because often people ask me, when did this drive of health equity start and advocacy? And I'm like, this started way, even from the get go. Because as I was learning things, I kept thinking, well, why are we doing that for Black patients? I don't understand that. And so my personal journey has been asking these questions, having people look at me saying, well, why are you questioning that? That's the way we do it. And I've been one to kind of push that needle in a way where I think one of the best compliments someone told me was in a disarming way, where I come from a level of curiosity and I ask, why are we doing these things? And if that answer doesn't seem right to me, I push a little bit more and I dig, but I always have my data and everything else to support it. And so it was a rough journey, but I didn't let it stop me. And I think that's one thing that we have to think about is, Black and Brown students, we are pushing through so many different hurdles and challenges to get through. And as from a female perspective, and then I'll get into that intersectionality part, you know, people thinking that I would say, "Oh, I'm, studying to become a doctor." And they would say, "Oh, you're studying to be," and they would use different professions. And again, I want to say I tip my hat off to all healthcare professionals, but they weren't acknowledging the one that I was going for as a physician. And it really made me realize that they didn't hear me. They didn't see me because again, that landscape, we don't see people that look like us. So that imagery wasn't even there for them to even comprehend that I'm studying to become a doctor. And so I share in my TEDx talk, often, and it still happens. I'll go in and see patients and I'll say my name. Hi, I'm Dr. Curry-Winchell. And they think I'm a different healthcare professional, not their
mm,
physician. I've had people refuse to see me as their physician. I've also had this ongoing challenge, which I know several female physicians have, and then of course Black females or physicians of color, of calling me doctor. Um,
mm, yeah,
it's an automatic where there's this thought that you can just say bio without even asking. And again, I come from that place. Ask me. Let's have a
right.
conversation. And if I share it, then please acknowledge that. And it's not about, because I've also had people say, oh, is that boastful? No, it's something I worked for. It's something that
Mhm,
is a part of me. And it's a respect that I would give to somebody else as well. And that's why in my talk, I was very intentional about my words when I said, it might seem trivial that I get untitled because I wanted to speak to
Yeah.
everyone, but also highlight, women and women of color, that it's something that is happening to us every day. And so that has been really, a part of my journey, as well as advocating for what is a part of my delivery of healthcare as a physician. I am a doctor and I'm proud to be a doctor. And when you said, what is one of your most proudest moments? I have a couple. The first one I have to say is, I am so proud of my dad for being the man
Mm,
that he was and instilling in me. He always said, Bio, the world is bigger than you. What can you do each day to give back? And so I am proud that he
mm.
gave that gift to me in order to put it forward in everything that I do. And I am so proud to help other women of color become physicians, become healthcare professionals in any way that I can. I love being a mentor, a sponsor, anybody that can help bring that forward. And, lastly, is a health advocate. My goal is to really amplify the importance of equitable healthcare and reducing healthcare inequities and disparities and using different ways to reach people. And that's just my jam. I
Mm.
really enjoy it. And those are just some of the things. Oh, and I can't leave out, of course, I love my children and everybody else, but I do love them. And I also say, my family, they have been so supportive. And I'm very grateful for that. So, as you know, I created this series Beyond Clinical Walls, and
Yeah.
it's a grassroots series that my family, my husband helps me with. And we put out these little mini clips of just healthcare topics, highlighting information that's digestible, that speaks to marginalized communities, underserved, people of color. I debunk myths associated with certain
Mm.
diagnoses. And it's brought me joy just to put it out there. So that was a lot,
That's
but there's a
awesome.
lot.
No, that I love it, and you can just tell just listening to you speak about, um, this topic that this is real for you. This is just not someone hopping on a trend. As we know the past couple of years, diversity, equity, health equity, inclusion, it is like it is the flavor of the week kind of a thing. And there are people that are about that life, and there are people that are about getting the paycheck from that life. If you know what I mean, but you can definitely tell this has been a lifelong journey for you.
Well, thank you. And, and this makes me think of, when you talk about who is invested, who is, as my dad likes to say, put your money where your mouth is. I think that's what he
Yeah.
said. I'm terrible with saying. So,
Yeah.
he would, that's the goal. Like, what are you doing to put the work forward? What are you doing for communities? How are you helping them where they need to be? And we always hear this saying, reach people where they are. Well, if you want to do that, you need to ask, where are they? Like
Yeah.
that is how you reach people. And so I think that's something that we have to think about. And, when you were speaking about the COVID, the shot and so forth, I remember, of course, when the pandemic started, I thought to myself, how can I help people in a way that may help them, answer their questions? And so myself and a couple of other doctors, we were able to get faith leaders, community leaders, trusted messengers together and share the health information that we know to them. They in turn delivered it to their congregations, their communities, different organizations. And that led to an invitation for us to speak because they were the delivery. And that's the thing,
Mm,
because they found out
right.
what were the questions. And so then we spoke to them, and then we did health fairs, vaccine clinics, and we did it different. Number one, you didn't have to have a vehicle to get there. You could walk up, and that was important. Another piece was we had where you could just come and ask a question. There was no where you had to walk up and get something. You didn't have to get
Right.
anything. You could just come and ask a question. So those are ways that, when we talk about delivering equitable healthcare, access, trust, do it and but think of ways that are intentional and keep asking why, because that is a gift that will deliver the opportunity to reduce those inequities and disparities.
Yes. So there's two things I got from this conversation that are so simple when you say it. It's like why aren't more people doing this? And it's just meeting people where they're at and asking them where they're at. Where are you in this journey? And then asking why. Two things that everybody can do that are so simple.
Yeah. And it goes back to when you ask the question, what can providers that are not of color do? What can community leaders, what can everyone do? Whether you're in the clinic, whether you're at a community fair, whether you're just having a conversation with someone, ask why. That's huge.
Mhm.
Ask them where they are, what they need, because that's the fundamental piece to get to change.
Right, right. That's great. So my last question here. Um, Not only are you a doctor at the healthcare system, you're a doctor at home.
Yes.
So are you one of those moms when their child is sick? One of those healthcare moms. My child is sick. Are you the ain't nothing wrong with you?
Yeah. Yes, I am. I'm like, "You are okay.
Yeah.
You don't need a Band-Aid." Absolutely. When it comes to my little ones, they'll say, "Oh, well, my mom says I'm okay." As like when they fall down, I'm like, "Get up. You're okay.
Yeah.
You're okay. Is anything coming out of your, skin? Are you bleeding? Oh, if you're bleeding, it's not a lot. We're okay. We're okay."
Yeah. So my wife is a nurse. My daughter, this was about a
Nice.
month ago. She had a fever. It was like 101, whatever. And my daughter's like, "Oh, I have a fever." And my wife is like, "A fever's good. You'll be fine.
Yeah,
You
you're
drink
all
the
right.
water." And she's like, "What?"
That's exactly the same in my household. I think my little ones know there's a threshold for blood. Like, come on, if it's a tiny little bit where I have to, like, squint, which my six-year-old be like, "It's right here, mama. It's right here." I'm
I
like,
know.
"Jalen, JJ, if I can't see it, if it's not, like, gushing, we're okay." So,
We're
yeah,
okay.
we have similar households. I'm like, "You're fine."
You're fine. That is so funny to me.
I
Oh,
think it's, like, universal in healthcare households where we're just like, no, you're" yeah,
yeah, well, and you see so much, right? You see so
yeah.
much, you're like, "This ain't nothing compared to what I saw before." Like, you'll walk it off. Like,
And my husband's like, "Are you sure, babe?" I'm like, "I'm sure," like, and yeah. And he's not questioning me, but he's like, because but now it's still every time he's like, "Okay, okay," and I'm like, "See?" But then when I am wrong, because sometimes things progress and you're like
oh, yeah.
and then you feel bad, and my, six-year-old or my eight-year-old be like, "See, I told you."
The one time I was wrong. Okay, I got
Yeah, I'm like, "I'm sorry about that. I'm doing the best I can." Well, one scene I love, my eight-year-old, she is just, both are so smart, but my eight-year-old has these amazing, ways of commenting on certain things. So I'll say, "Jordan, give me a break." Like if I forget something like a theme for school, because they have all of these different themes that you have to remember. Disney Day, it's so hard to
right.
remember. And I'll say, "Jordan, give me a break." And she's like, "You've been asking for a lot of those lately." I'm like, "I know." And so there I have to admit it and say, "You're right, kid. You're right."
You're right. Dr. Curry-Winchell, thank you so much for this great conversation and just being on the podcast with me today. For those that are listening that want to know more about you, want to learn more about what you're doing, and just connect with you, where can they find you?
Well, I am on all social media. Primarily, TikTok is actually so much fun for me. So, TikTok, LinkedIn, Instagram. I'm also on Twitter, but I would say TikTok and Instagram and LinkedIn are the top three for me to connect, as well as I have a website, and it's drbcw.com. And all of the information there is free. There's healthcare videos under Beyond Clinical Walls, and just different articles that I've written for different publications that are all free that talk about different topics. So I also have a YouTube series as well, the Beyond Clinical Walls. So you can find me there through Beyond Clinical Walls and find free health information.
Awesome. Well, again, and I'll make sure I link all those in the description of the episode, so everybody can have an easy way of getting those as well. Again, thank you so much for your time, and everyone, thank you for listening to the Healthy Project podcast. I'll holler at you next time.